Hi, my name is Lisa. I'm a nurse on the pediatric unit. I'm here to talk about coarctation of the aorta. This is a narrowing of the lumen of the aorta near the ductus arteriosus that results in obstruction of blood flow from the left ventricle of the heart. I have a diagram here that shows this is the narrowing, this is the aorta, and this is the narrowing that causes obstruction. The ductus arteriosus is a normal fetal blood vessel that connects the aorta and the pulmonary artery, allowing for blood to bypass the lungs before birth, but it usually closes shortly after birth. Signs and symptoms that you will need to watch for is bounding pulses in the upper extremities and weak pulses in the lower extremities. You may also see some changes in the skin where the lower extremities will be cooler to touch. If you are checking the baby's blood pressure, the blood pressure will be elevated in the arms and lower in the legs. This can cause heart failure in infants. However, as your baby grows into a child, they can have headaches, dizziness, fainting, and nosebleeds. Medications that are given for coarctation of the aorta are prostaglandin E1, beta blockers, diuretics, ACE inhibitors, and vasodilators. Prostaglandin E is given to newborns to keep the ductus arteriosus open to improve the blood flow to the lower extremities. ACE inhibitors and beta blockers are given to control high blood pressure. Diuretics are given to help the body get rid of excess fluid and prevent congestive heart failure. Vasodilators are given to relax the blood vessels to improve blood flow. Surgical intervention is the most common treatment of the coarctation to remove the narrowed section of the aorta. Sometimes they can be taken for a cardiac catheter, and the catheter can be placed into the heart, and a balloon angioplasty can be done, and a stent placement possibly. If that's unable due to severity, then they would have to do the open surgery and remove portion of that aorta and reattach both ends, giving your baby the best outcome. To monitor your baby, the best things I can tell you to look out for is that if your baby has difficulty feeding, if they become short of breath, if you have trouble keeping your baby awake or even waking them up, and if you notice any changes in the color of their skin, especially the nail beds around the mouth and the hands and feet. Best advice for us to give you is if you feel there's changes in your baby, you need to call the doctor. There's no question that is a bad question. So best to know, when in doubt, reach out. Thank you for listening.